If you've been waking up bloated, stiff, or deeply exhausted, even after what should have been a full night's sleep, I need you to hear this. That heavy feeling in your abdomen, the stiffness in your hands when you try to make a fist, the way your knees protest before your feet even touch the floor. It's easy to dismiss it as just getting older, but what if it isn't? What if your body has been trying to send you a signal, quietly and consistently, and no one ever explained what it means? Think about your body like a house. Over the years, the plumbing slows down and the filters get a bit clogged. If you do not maintain the pipes, pressure can build. In your body, that can show up as puffiness in your ankles or that lingering brain fog that does not lift easily. We have been taught to treat symptoms. We rarely talk about the systems responsible for fluid balance, immune signaling, and waste removal. There is a natural compound that researchers have studied for its effects on digestive motility and inflammatory pathways. It has been used therapeutically for decades, and yet most women over 60 have never been told how it actually works or how it has been studied in clinical settings. Stay with me. What I am about to share is not folklore. It is biochemistry. Let's begin.
Here is what many women experience after 60. You wake up with a puffy abdomen, even though you ate lightly the night before. Your joints feel stiff, not just your knees, but your hands, shoulders, and lower back. You sleep through the night, but you do not wake up restored. You are told this is normal aging. Physiology suggests something more nuanced. These symptoms are common with age, but they are often connected to changes in circulation, inflammation, medication effects, and digestive motility, not simply wear and tear. Your lymphatic system helps regulate fluid balance and immune surveillance. Unlike your circulatory system, it does not have a central pump. It relies on movement, breathing, and muscle contraction. Reduced movement, especially overnight, can contribute to temporary fluid redistribution. That may partially explain morning puffiness or stiffness. This does not mean your joints are gone. It means circulation and inflammatory signaling can shift during sleep. And here is what most women are never told. Your body follows predictable biological rhythms. Many repair processes increase during sleep. Before I explain how this connects, let me be clear. This is not a miracle cure. It is a tool. And like any tool, it works best when you understand what has actually been studied and what has not. So let's look at what we know. Castor oil contains a fatty acid called ricinoleic acid. It makes up about 85 to 90% of the oil. In pharmacological research, ricinoleic acid has been shown to activate prostaglandin EP3 receptors in the intestine. These receptors are involved in smooth muscle contraction and inflammatory signaling. This mechanism has been demonstrated primarily in laboratory and animal models. It helps explain why oral castor oil functions as a stimulant laxative. That mechanism is well documented in peer-reviewed research. What is less studied is the degree to which topical application produces the same systemic receptor activation. While castor oil packs have been used traditionally, high-quality clinical trials on transdermal systemic effects remain limited. Your lymphatic system removes excess interstitial fluid and supports immune cell circulation. It depends on movement and muscle contraction to function efficiently. During the day, regular movement helps support lymph flow. At night, when you are still, circulation patterns shift. Some practitioners suggest that applying warmth and gentle topical stimulation to the abdomen may support relaxation and comfort. Strong clinical evidence showing that topical castor oil directly increases lymphatic flow is limited. After 60, changes in vascular tone, connective tissue, and physical activity levels can influence fluid distribution. This helps explain why swelling in the ankles or facial puffiness may become more common. There is one small pilot study published in the Journal of Naturopathic Medicine that observed temporary increases in certain lymphocyte levels in participants using castor oil packs. However, this was a small study from a specialty journal and has not been widely replicated. Larger controlled trials are still needed. Ricinoleic acid clearly affects smooth muscle when taken orally. Oral castor oil stimulates peristalsis, the wave-like contractions that move food through your digestive tract. That is why it has long been used as a stimulant laxative. For many women over 60, digestion can slow. Certain medications, including some blood pressure medications, pain relievers, and calcium supplements, are known to contribute to constipation. When digestion slows, it can cause bloating and discomfort. Constipation itself can contribute to a sense of fatigue or heaviness, although energy levels are influenced by many factors, including sleep quality, blood sugar regulation, and inflammation. Applied topically over the abdomen, castor oil is traditionally believed to support digestive comfort. However, clinical evidence demonstrating that topical application improves motility in the same way oral dosing does is limited. Now let's talk about timing. Your body runs on a circadian rhythm. During sleep, your parasympathetic nervous system, your rest and digest mode, becomes more active. Repair processes, immune regulation, and hormonal signaling follow predictable overnight patterns. Applying a castor oil pack before bed may complement relaxation simply because you are pairing it with a period of rest and warmth. There is no direct clinical trial comparing nighttime versus daytime application, but many people find bedtime use more convenient and calming. Think of it as aligning a relaxation practice with your body's natural rest phase, rather than forcing change during a busy day. Here is how to use one safely. Step 1. Choose high-quality, cold-pressed, hexane-free castor oil stored in glass. While castor oil is chemically stable, glass storage minimizes potential contamination from certain plastics. Step 2. Fold a soft flannel or cotton cloth large enough to cover your abdomen. Step 3. Saturate it so it is damp but not dripping. Step 4. Lie down and place it over your abdomen. There is no strong evidence that targeting one specific organ location changes the effect. Step 5. Cover it with a towel to protect your bedding. Step 6. You can place a heating pad on low over the pack for 20 to 30 minutes before sleep. Gentle heat increases local blood flow and promotes relaxation. Step 7. Leave it on overnight or remove it after 30 to 60 minutes if preferred. Step 8. In the morning, wipe the area with a warm, damp cloth. Store the pack in a sealed container. It can be reused several times if kept clean. A few precautions. Do not use castor oil packs if you are pregnant, have an active abdominal infection, or have been diagnosed with a bowel obstruction. Oral castor oil can stimulate uterine contractions, which is why pregnancy is a contraindication. If you take blood thinners, diabetes medication, or blood pressure medication, speak with your doctor first, particularly before using oral castor oil. Topical use is generally considered low risk, but individual circumstances matter. Always do a patch test on your inner forearm and wait 24 hours. If irritation appears, do not continue. And remember, discomfort is a signal to stop. Now regarding joint pain. A randomized clinical trial published in Phytotherapy Research in 2009 compared oral castor oil capsules to diclofenac capsules in patients with knee osteoarthritis. The study found that oral castor oil showed comparable improvement in symptoms over 4 weeks. However, this study evaluated oral use, not topical application, and it was relatively small. There is currently limited high-quality evidence that topical castor oil applied to the abdomen directly reduces joint pain elsewhere in the body. That said, digestive health, inflammation, and musculoskeletal comfort are interconnected systems. Supporting overall gut health, movement, and sleep can indirectly influence how your joints feel. Here is what is often misunderstood. Castor oil does not cure inflammation. At most, it may influence certain biochemical pathways, particularly when taken orally, and may support comfort when used topically. Your body still has repair capacity. Meaningful change usually comes from consistent habits. Movement, sleep, nutrition, hydration, and medical care when needed. You will not wake up with a flat stomach overnight. You will not reverse decades of joint wear in a week. But with consistent use and realistic expectations, some women report a sense of abdominal comfort, less perceived bloating, more regular digestion when combined with proper diet and hydration, a calming bedtime routine that improves sleep onset. Not miracles, supportive practices. Your body has not given up on you. It is still capable of adaptation and repair within biological limits. This is not about fighting aging. It is about understanding what is evidence-based, what is traditional practice, and how to make informed decisions.